Hi everyone, thanks for watching this short video. Dan Rinella, Prosthetics and Orthotics. We're going to be talking a little bit about shrinkers today. What is a shrinker? How many do people get? How do you usually apply this kind of thing? A person wears a shrinker when they have swelling, and a shrinker is usually tied to an amputation. Now, some other people might wear a compression garment, a compression stocking, if it's an unamputated limb. But a shrinker is typically, at least in our field, in the prosthetics and orthotics field, when somebody says that word, they are referring to a shrinker for someone who just had an amputation. And most of those individuals are someone that is a below-the-knee amputee, or they might be an above-the-knee amputee, and that's the majority of the cases. However, upper extremity amputations do occur worldwide every year. When it comes to shrinkers, we can tell you some of the problems that we see with them and how to actually apply them. There is a tool called a donning tube that we recommend if you're able to get one. I don't think insurance usually covers it or any sort of coverage. Perhaps a workman's comp might. You probably have to check in with your prosthetist and the particular item that they're giving to you. Usually, in our experience, a donning tube is not covered, but what it does is it pre-stretches this compression garment, this shrinker. And that way, a sensitive residual limb will not feel the motion of a shrinker going up the residual limb, and that will decrease pain in the application process. I can tell you some of the problems that we see with shrinkers is that people put them on wrong basically all the time, is my experience. It's not every person, it's not every scenario. I should probably step that back a little bit, but they're put on wrong a lot. And one of the things that I see it happen a lot is that someone has it on inside out. When the tag, you can see the tag, it's not on probably per the manufacturer's instructions at that point. Also, a lot of shrinkers have these silicone beads at the top, and if you can see those beads on the outside, it's probably not on correctly. So if you have those silicone beads, they should always basically be against your skin. And you can see those in two different ways. Someone actually can put a shrinker on right and then flip the top, and you can see that there are these silicone beads at that point. Otherwise, people can just put the shrinker on inside out, and that way you can see those silicone beads as well. Another very common mistake that we see is the bottom of the shrinker is not up against the bottom of the residual limb. There's like an air pocket in there, and they're not really designed for that. Now, you might be that one person out of 100 that needs it that way for a particular reason, so we have to tell you that you should probably check with your orthotist just to make sure, but usually they're not made to treat air pockets. They're made to treat your residual limb and to help shrink it down, and it's not doing anything if there's a whole bunch of air inside there. Okay, so you got to make sure to bring it all the way up usually. The last point we want to make about these shrinkers is that sometimes people are really strong, and they can lift them up, they can stretch them, and they don't like the way it might feel behind their knee for some reason when it's bent or whatever the situation is. So a lot of times people flip those shrinkers, but that's not exactly what the manufacturer usually had in mind for you when they did this. If you can imagine, the shrinker has a strength to it, and it's measured in millimeters of mercury. There's no mercury in the garment, don't worry, but that's how they measure the strength of this, okay? The size of it should have been figured out by the clinician from the prosthetics and orthotics company for you. If you have a shrinker, you can imagine a scenario with this shrinker where, like we said, somebody pulls it up and they don't like the way it fits, so they flip it over. So what happens is the strength that we're talking about with you is, we'll just say, for example, there is at the bottom of the garment, okay, here I come with the hands expression again, but it's 30 at the bottom, and up higher it's 20. It's trying to flush fluid upward. What would happen, in your opinion, when you flip the top of that garment, the 20? We could arguably say that that is much stronger now than the 20 it was meant to be. I would argue that we could make a case for that being closer to 40 now than 20. Depending on the newness of the garment and the strength of that garment, you probably want to avoid flipping those garments if you can. I've never seen someone do that and follow the instructions at the same time. As far as quantity of these garments, you might want to consider talking to your prosthetist about getting more than one. Why is that? because just like a pair of socks, you probably wouldn't want to wear it for 2 days straight, right? So if you have a pair of socks, you clean that one night, and then you can go to your second pair of socks in the morning and switch it out. So if you can kind of rotate shrinkers, that's a great thing. That is something that will also help to improve the shelf life of this device, or this compression garment, I should say, for you. One of the dangers, if we want to use that word, of a shrinker is that someone just wears it and it's stretched out. You don't want that. This compression garment was made to give your residual limb like a hug. So if it's very easy to put it on, it's probably either worn out or it's old. So I would give your prosthetist a call and ask them to reconsider giving you a new one to help you in your shrinking process. I hope this information helped. Please, by all means, call us with any questions or concerns regarding prosthetics, and we would love to answer more questions that an amputee has that we have not done so in our blog or in our learning center. Thanks.